Evening, everyone. Thank you for being here today, and thank you to our sponsors, the U.S. Embassy, PepsiCo, Alayan, ExxonMobil, and Sanofi. And thank you to American Express for hosting us here today. And with a special thanks to our long-term partners, the Atlantic Council, with whom we have had many events over the past few years. Women have played an integral role in the healthcare industry for centuries, from midwives to nurses, to doctors, to researchers and administrators. Women have demonstrated exceptional skills and dedication in delivering quality patient care. Often considered natural caregivers, women bring empathy, compassion, and a unique perspective to healthcare settings, and their presence has helped shape patient-centered care models around the world that focus on holistic approaches to healthcare management. Although globally, healthcare continues to outpace other industries in their inclusion of women, still, the industry faces many challenges and women face barriers to inclusion. Women also have a major role in healthcare at the level of their own families. As many of you know, in many households, women are the managers of their family's healthcare needs, from choosing the service provider to taking the children to the doctor's appointments and then to following through with care. So today, we are joined with our esteemed panelists to discuss the role of women in healthcare in Saudi Arabia. And with that, I would like to introduce our moderator today, Noor Nugali, who is acting deputy editor-in-chief at Arab News. She has successfully covered foreign policy and several high-level interviews, including the Crown Prince Mohammed bin Salman's international tours. She has also moderated and participated as a panelist at G20 and the Arab Women Forum. Her most notable interviews, and this was my favorite fun fact, is she interviewed John Kerry and recently the Ukrainian Foreign Minister, Dmitry Kuleba. Thank you and welcome.
Thank you so much, Dana, for that wonderful introduction. And I believe everyone here is very excited to get on with this amazing session. It's a very timely, it will always be worldly, and I'm honored to be amongst such distinguished speakers and guests today to talk about this. Once more, we're going to say the title of this session, Women's Economic Participation and its Impact on Healthcare in Saudi Arabia. Both very important, both equally timely. And let me introduce our amazing speakers. So we have Dr. Fatma Al-Hamlan, consultant and women's health advocate, King Faisal Specialist Hospital and Research Center. No one wants to. And we have Samar Nassar, Managing Director for Healthcare Services and Technologies, Saudi Arabia's Ministry of Investments. Naseem Al-Mulla, Director of Customer Experience, Council of Health Insurance. We're going to be asking the distinguished speakers and panelists questions, and we'll leave room for questions after the session. So that's going to be 15 minutes before it ends. I want to begin with asking a very crucial question to all of you. And I think this really impacts many people here in Saudi Arabia and across the world. In your respective sectors, how do you envision the future of women's participation and its transformative impact on the Saudi Arabian healthcare system? Let's start with you, Dr. Fatma.
Sure. Thank you, everyone, and thank you for having me. When it comes to women participation, especially in the healthcare sector, we always need women. If you look at the nurses per se, most of them, they are women. And also, we are empowering women as physicians. We need women in the healthcare sectors. And as we look to Saudi healthcare sector in particular, women have been empowered a long time ago. Even if you look at the STEM grad, even including the medicine, usually females, the statistics is higher than men. So we never had a problem with this, with the women participation. We get stuck with the leadership position. They get hired, then they are stuck in the early career, they never advance. If we are talking about women in the healthcare sector, I think this is something that we need to work on. But so far, everything is going very well when it comes to women's participation in the healthcare sector.
Yeah, I want to echo what Doctora said. I think the discrepancy becomes very evident when you see that the dominating sectors where women are highly participating are healthcare and education. But this is more general workforce. But if you look at executive leadership positions, I mean, since I started my career 20 years ago, it's been 20% across Fortune 500 companies and healthcare specifically as well. And then also, if you look at women entrepreneurship, I just met Nadine. There aren't many women entrepreneurship in general, let alone healthcare as well. But in terms of an economic impact, to answer you precisely, it's pivotal, it's imperative, and there's so many things that will come out of it. And I could name a few. Diversity, innovation would be, an output or an outcome of that. You're also you're capitalizing on the brain power of not just men, also women. And there's more women with higher education in Saudi Arabia. That used to get married and stay at home versus now. Now women are occupying jobs that women never did when I started my career. I keep using my example. I think we all have very similar experiences. And I think also when more women are in the workforce, it means, more disposable income as well. So more spending, more productivity, and more leverage of healthcare services as a result of that. I want to speak about investments because I'm with the Ministry of Investment. Diversity also makes Saudi very attractive when we're more inclusive and have more women, not just in the workforce, in leadership positions, and nurturing and prospering the entrepreneurship ecosystem overall.
Thank you so much.
Good evening, everyone. I also agree with Victoria because since I was in healthcare, since 1999, I've seen women. It wasn't like, and it was, I think, one of the first fields to have mixed environment. So that wasn't an issue. However, only recently we started to see women at the executive table, steering teams. But it's still, there is limitation when it comes to women being in financial decisions, digital transformation in the healthcare. However, in the service line, there are promotion and they contribute. So I think now is the time to also move into the operational engineering facilities. Financial decisions are very important. So this is my experience. So there is a lot of work to be done, but I was lucky to be in healthcare because I did not really suffer from.
You're forcing me to ask you a follow-up question because I have so many inquiries about this. I think all three of our distinguished speakers gave almost the same relative answer. My question is, before, education and healthcare were the #1 occupations led by women in Saudi Arabia. And now with Vision 2030, we see many going to the Ministry of Investment, for example, in different ministries in different areas. Do you see a bright future for Saudi women in positions in healthcare in the near future? I would love to hear answers. And how would this happen? Is there like an example that you can give of something that's happening now?
I will start because I have an exciting story, and I'm sure all of you heard about Rayana Bernawi.
Yeah.
Okay, the astronaut. She used to be a researcher in King Faisal Specialist Hospital. She used to work in a hospital, in a lab, doing experiments in the lab, and where she ended up in the space. Really, like the space is her limit. So if you tell me like 5 years ago, would you imagine this happening? Someone working in a lab, and it was a gene editing lab, And now she will go to the space, do experiments we never thought of. Because we always believe you have a career and you have to stick to your major. She's never been a space scientist, she never been an astronaut, but because she has the drive, she was ready to learn, she was selected. So really, there is no limit. If you have the bright mind, they can adapt and they can learn and they can achieve whatever they want.
That is so inspiring. So from a lab to space.
To space.
Okay, I think it gives everyone reason to try harder and be better. I would love to hear from you also.
Yeah, I mean, I also like, I would challenge what you said, if you don't mind, because I've been in healthcare all my life, but I found it very hard it was because I was more on the private side. I wasn't working in a hospital. I was technically a sales rep when I started my career with Johnson and Johnson. And I still remember when I applied for the role, it literally read, we're looking for a male medical representative. It was on babe.com. LinkedIn didn't exist at that time. I'm that old. But I mean, I applied for it and J&J, believed in me and they hired me, but I was the only female for the longest time ever as a product specialist or a medical rep. And it was hard, and it all the way from like being harassed or being questioned, why are you doing this? Standing still. So it wasn't very smooth, but also I agree with Doctora again, because, despite all of this, I am here right now. I oversee a sector. I'm part of the new government. So the sky is the limit. And I think, the general theme is empowering women and more women in leadership, not just in the workforce, is what we're seeing right now, not just from a public sector standpoint, also from a private sector standpoint.
Absolutely. I completely agree with this. I would love to hear what your thoughts are.
So just to add to what you said, when I say I didn't suffer much, it wasn't an easy ride. No, it was difficult, it was challenging. And I think that one of the most difficult things to do is how do you present yourself to men to be taken seriously, at the same time keep your feminine sense and not being overly aggressive. So it's a very difficult balance because you have to tiptoe somehow. So it was never easy. However, the environment had some foundations because we had a lot of Americans in the healthcare as department directors or instructors. So it was familiar to see women, making decisions and, doing these things. However, it was not easy. I had to do a lot of education. I had to really work on myself. And with regard to what's coming next, I think now we have more of a structure and direction for women. So in the past, it had to be based on, proving yourself as a personal effort, having good networks. Now we have some kind of system in place. We have percentages to be filled and KPIs to be met. So I think now it's I wouldn't say easier, but there is clarity and direction, which will make it more focused for the new generation to direct their efforts and to navigate it without, major disasters, if you like.
Absolutely.
So it's not easy and it's never going to be easy. However, I would still advise the young generation to be patient. And there is nothing like building your confidence. This is your treasure. So because now I see a lot of the younger generation, they're just in a rush, which can be a trap. Because if you fall into, especially in healthcare, it's a science-based sector. So not having very strong capability and stamina and resilience and rushing to be in the leadership. So that would be very difficult. If you make a mistake, it will count as 1,000. This is my intro advice. So patience always pays.
Thank you so much, Naseem. So stamina, resilience, and patience are three key words for
and developing your own competence.
Absolutely.
That's very important.
That's a great advice, I think, for all the young ladies to adhere to. To talk a little go back to you and ask you a question. So, as women's health advocates, what changes have you witnessed, observed in the healthcare in Saudi Arabia? You wear many hats and you have many different roles. So, what are your observations of those sectors, can we say?
Absolutely. In the recent years, Saudi Arabia has gone through different changes when it comes to the healthcare system. So the best thing that has happened is the reform that took place, the legal reform and the social reform when it comes to women in healthcare. The most important one, women, they don't need a male guardian approvals to get treated, to get decisions. They are autonomous, they are independent, and they kept their confidentiality, which is very important for us as an advocate for women's health. So this is done. It was part of the legal reform in the country that was very important for us to advance other agendas. When it comes to women's health in general, in 2018, King Faisal actually started to have a women's health clinics. Then Dr. Munir Al-Bugumi, she started the Women's Health Fellowship. So even we have subspecialties. It's not only a physician specialized in women's health. We have a mental women's health as well. So these are things that's happening. We started to hear about women's health. We usually, when we have a women want to go, usually it's the maternity clinics, it's the OBGYN, it's the women bearing age. It's like there is no clinics for the youngster or like the elderly. So now, no, we have the women's health clinics. We have it in the mall. Because we are advocating for accessibility. It has to be accessible for everyone. Not every woman can take her kids and go to the hospitals for several reasons. When you talk to the community, sometimes no one would take her, or it's hard to take her kids with her. So we provided them in the malls. And actually, since we have entrepreneurs, there are so many opportunities and potential ideas and social entrepreneurship, because this is a value-based project and value-based business. There are so many ideas that we can do and help the community. The best thing also happening right now in Saudi, we are hearing health and wellness. Maybe you are hearing it a lot. We are not disease-oriented anymore. We do have the best hospitals. We have the latest technologies. We are doing robotic surgeries. We have AI integrated in the healthcare system. However, we are pro-prevention. We are in the era of preventive medicine. We don't want to see more patients in the hospitals. We want to work on the health of our community and the quality of life. If you look at the definition of health by the World Health Organization, health is not the absence of disease. It's the mental status of your health and the complete mental and physical and social status. That's how you live. Even if you have a chronic disease, you can get it treated, and still you have to keep everything completed in your life, and you have to adapt and adjust. And this is the quality of life. Even if you are sick, there is a palliative care. You don't need to suffer. There are always solutions. And this is the entrepreneurs, usually they take care of these things. Even if you have sick patients, how can we treat them? There are so many options that we can do. Since you are talking about different hats, so I work in a hospital, but at the same time, I'm a founder of an organization called Rufaida Women's Health Organization. And this is my advocacy arm. Whenever we are facing any challenges in the healthcare system, we usually take it through the civil society organizations, because we are the voice of people. We do research in the hospital, we collect data, then we make the action through the civil society organization. And Dr. Manal, she's here with us. She's actually an expert in Rufaida Women's Health Organization. We empower even the expert to get more voices, and this is how we advance the healthcare system. Regarding the private, I will talk more about the PIF projects and what's happening right now in Saudi. I'm sitting in one of the advisory boards. And again, it's health and wellness. If you look at the first company that's taking care of women's well-being, which is Kayani, I'm sure you all heard about Kayani. It's a fitness company. They want to empower women. They want to have the infrastructure, because if you are encouraging women to do sports, to join sports, if you don't have the course, if you don't have the infrastructure, if you don't have even the supplies, you cannot do things. we moved from the import and things like we depend on others. Now we have to be self-sufficient. And this is happening with this sector, even the pharmaceutical, even the vaccines, even the lab tests. Now we are looking for localization. And if you look at the PIF announcement almost every week, we are seeing an announcement of a company. Again, it's most of these companies are in healthcare and also in health and wellness. Not mentioning the Ardara, what else? We have the Asir Investment Company, Amala, Abha, Asir, it's Neom.
We're losing count.
Yes. They have this health and wellness all over. And this is really encouraging because really we want to stop diseases and we want to enjoy life.
That was absolutely true. Quality of life is one of the pillars of Vision 2030, and we've seen such a massive change. Thank you so much, Dr. Fatima. Someone, I want to go ask you a question regarding female involvement. So would you give us an overview of female involvement in the healthcare industry, especially female entrepreneurs? Are there any stories you personally would like to relate or gaps you think that could be addressed?
Thank you so much. I think, you know, we touched upon it briefly, all of us. The composition or the ratio of women in healthcare is quite big or high. It's according to the WHO, it's about 70%. This is worldwide. In the US, it's a bit higher. It's 76%. But again, this is general management. This is practitioners and technologists. But then if I would compare this to Saudi, again, the number is, I'm trying to remember, it's 40% according to the Saudi for health specialties. I forgot their name.
The Saudi Commission.
Commission for health specialty. So the numbers are quite healthy. But then if you start looking at, you know, what are the type of roles that women are filling? So if we again go to executive leadership, it's usually 1 or 2 in 10. The 20% cap has been stagnant for a very long time, over a decade, more than 2 decades, I would say comfortably. And then if you look at, innovation in healthcare, is an industry that is very risk avert because at the end of the day, the end user is the patient. So you need to be, protective of that. There's also the data privacy and so on. So if you look at the ladder around, startups and entrepreneurship, healthcare is at the bottom of the ladder. If you look within, but COVID has proved that healthcare is resilient.
Yeah.
We were able to stand still. We were able to accelerate things that, things that were planned in 3 or 5 years were accelerated over just a few months, especially around digital adoption and virtual care and so forth. So the number is very small. I don't think there's a number. I think the number is below 1% in the entrepreneurship and the innovation startup space. I have not met a female entrepreneur from Saudi, and I work with a lot of companies, investors, large, medium, and small. I work with a lot of private equities and venture capitalists. But if I would highlight one that has done well, it's not from here, it's from the UAE. The founder is Sophie Smith. It's called Nepta Health. It's a women's health app. And again, women's health is a huge topic. We could spend the whole evening talking about women's health because basically diagnosis and technologies that are designed in healthcare are actually built based on men's physiology, not women's physiology. So when a woman goes through a heart attack, it's the symptoms of a man that we learned. So we'll save a man faster than saving a woman versus so many other things. Also, if you look at female researchers, if you look at funding for these femtech, women in tech, STEM and so forth, it's not very inclusive as well. I think the gap or the discrepancy is wide. If you look at general management or workforce participation, executive leadership, and in entrepreneurship / innovation, it's like super high, 70%. Then you go to 20%, then it's almost nothing. In MISA, I'm obviously I advocate for this big time. But I think beyond MISA as the Ministry of Investment, we need to create mentorship programs that nurture promising talent in healthcare, put them on the right roadmap to develop their ventures, get them ready to get the funding that they need. And at the end of the day, it's not only equity. Yes, it is equity, but it's also diversity. It's also innovation. It has an enormous economic impact at the end of the day. I can carry on, but I'm mindful of time.
I had one follow-up question,
Yeah.
if that's okay, because now we are in the era of opportunity. The Vision 2030 is not only just a namesake or a word that we carry lightly, it's actual change on the ground that's happening. I'm so surprised by these numbers. So is the reason that women are fearful going into ventures or being entrepreneurs in the women healthcare, or is it because they have no funding, or is it because there's no excuse?
Yeah.
The opportunities there and the
Yeah, I think you'll find more opportunities in art and fashion. Suddenly, everyone is an artist. I mean, I can't pinpoint why, but I see more people, focused on self-expression and different forms of art, which didn't exist from before.
yes.
Dancing and music and fashion and there's always something new. And there's so many grants. There's so many grants that Ministry of Culture gives and what is it called? Residencies. But you don't see this in healthcare.
So there is a gap.
There's a gap.
And we need to fill it, inshallah, and hopefully soon. With your mentorship to the young ladies, inshallah.
I mean, I can tell you more. So what MISA does is obviously attract foreign direct investments into Saudi. And when it's not just FDIs that we bring to the kingdom, we also want to bring the know-how, we want to bring the technology, we want to localization, supply chain localization is very big for us. When you look at all this, when I speak with Oracle or IBM, and I always make it a point to say that we need to create some programs for women. You need to increase women participation or in your recruitment strategy. You need to put them on intense development trainings and programs. So, I mean, we try to do this, but this is a long-term strategy.
Absolutely. Thank you so much, Naseem. According to several studies, women perceive their health as inferior due to various factors, including childbearing, I think we all know that, and domestic and caregiving roles, psychological stress, related. What are some notable trends or shifts in healthcare insurance needs related to the growing number of women in the workforce?
Okay, let me start from the health insurance.
Yes.
I'll just go back once in history. In 2005, private health insurance for expats became mandatory. And the Council of Health Insurance started to do inspections to make sure that the private companies are complying. Back then, the majority of the private workforce were male, especially if you look at like large companies with manual workers, constructions. So there was coverage for female, but it was the same policy for male. Right? So in the past few years, as more women entering the private sector, staying in the private sector and shaping it also, now there is a focus to also have an access to preventive services and health promoting services for females, not waiting for a treatment. So last year in 2022, at the end of 2022, the Council with the Ministry of Health released an essential benefits package, which is basically having the minimum requirements of any health insurance policy. And that had special components for women's health, such as breast cancer screening, cervical cancer screening, pre and post menopausal care, of course, pregnancy, whether it's natural or cesarean, child health support, and also doing like bone density exam, which is called DEXA, to detect early osteoporosis. So that became part of this unified policy, which in the past it just depended on seeking that treatment. However, now it's part of that policy, just equally to what women have as an access. Now, going back to how we perceive ourselves, I think this is something very old. And I think instead of fighting it, we have to embrace that vulnerable, fragile, perfectly imperfect side. And I think part of it is also having access to support system when it comes to maternity care, maternity leave, and these kinds of things. I know there is a struggle in the healthcare sector. I would like more. I don't have any children, khalas, they're big now. However, in my old time, because I decided to breastfeed my second baby, I had to take unpaid leave for 6 months because I just wanted to be there. It was a conscious decision. Where I know in some countries they can give up to 3 years with certain amount of payment. So probably these areas to support women entering the workforce and staying there, because I know a lot of females, because I was involved in hiring, once they get married and get pregnant, they drop. They take a few years gap, especially when it comes to demanding work like nursing. Nursing is still struggling in Saudi Arabia. We don't have many Saudi nurses. There are cultural barriers. Payment is low compared to other healthcare professions. Demand is very high. There is night shift. There is, working very intimately with patients. I was a nurse one day, so being in the healthcare, I've seen developments for physicians, pharmacists. Still, nursing is one of the areas that's not being supported. And this contributed to severe shortage, and we're reaching now a very risky ratio because you calculate a ratio to say if you have a shortage or not. We reached, especially after COVID, many expats left. So this is one area that I think needs special attention, and we had a lot of meetings. But I don't know why it's not. So this is one of the areas. Being a female, it has to be embraced and supported through this.
I mean, when they say empower women, essentially you can't equalify between men and women because
that's not the point. Yeah,
Exactly.
that's how I see it.
So I think there is an issue here, especially with mothers, childbearing, nursing, also when they,
It has to be part of the process and part of the system.
yes.
And I just wish I just wish women don't keep themselves occupied by saying these liquid words like women empowerment, because it can be very tricky. So I believe having a place in the system, having some concrete privileges when it comes to women's health, prejudice because you get your period or things like that. I know payment, alhamdulillah, is equal. We don't have issues with
Alhamdulillah, yes.
payment inside countries. So this is not a big issue. Again, access to services, access to not only promotion, but having like facilities for childcare and these things. And these are very crucial, especially for young women wanting to start a family. Because they have to start family, they want to, now some of them delay starting a family because there is no access to these services, they don't exist in some institutions.
Thank you so much, Yassine.
If you allow me, I would like to comment on this because what you mentioned is very important. It's the support system. And some of us are privileged who has been abroad and got to see the best practices. And I think it's our job to come back and bring it. When you mentioned about the breastfeeding and the challenge you had where you had to take off, I had my 2 kids in the US. I was doing my PhD at that time. And I really got full support from WIC, if you know WIC in the United States, which is Women, Infant and Children. They told me we can give you the breast pump so you can keep pumping the milk while you are working in the university during that day. You put it in the fridge, then you go home and give it to your child. During the lunch hour, I would go to the child care, give them the milk. And they worked with me during that time. And I didn't have to take off. I was single mom. My husband has to come back home. And whenever I remember the support I got, made a difference. That's why when I came back to Saudi, I thought we need to support others. We need to provide the solutions and we need to speak up. Because if they don't hear our voices and they don't know what our demands are, they don't care. So I have been struggling. I know my colleague is struggling. We need to speak up. We need to make it a support system because at the end, you are supporting the company or the organization or the workplace. We are living in the workplace more than what we live in our home. It's like almost 8 hours, 9 hours a day. And it has to be enjoyable because it's a productivity.
Someone, would you like to add that to this
I
conversation?
mean, I don't have any children. I don't know how it works, but what I want to say is, I mean, it's increasing women participation is in the heart of the Vision 2030. It's one of the biggest goals and targets that we want to achieve. And if you remember the numbers, it was 22% in 2016 when the vision was launched to 30% in 2030. Guess we're at what number now? 33%.
Really?
So you know, with all what's happening, all the transformation, and I always say, you know, everything is moving, and in 2030, nothing is going to be where it was now because everything is moving. I think, you know, in order to achieve that, there has to be a skeleton that supports all of this. So I'm sure there are massive opportunities and ways to do that.
I can talk forever because it's really, you are putting it nicely, but the way I see it, it's getting worse.
Oh, wow.
Because women, they are spending more time at the workplace. They don't leave work before 6 p.m. and some at 9 p.m. How is she going to make a family if she's going to stay like this? I don't know. I would love always to do studies because what we are going through, it's a transformation. It's a social changes happening. Girls, they are coming really eager to work. They are giving it everything. Again, we need the work-life balance back. If you really care about the families, if you really care about individuals, because again, it's a quality of life at the end. You can work and you have to enjoy your life at the end.
If you allow me, Dr. Fatma, I agree. And now this made me think now, since the door is open for females, but they're still paving the way. Since it's not easy yet. So they have to put more effort. They have to be competitive. They have to prove themselves, which means again taking them away from. It doesn't have to be only family, but also contributing to society in different ways. So again, if you don't have the real support system that's helped them with these things, then they still have to struggle again, and it's a vicious cycle of struggling and struggling. So I agree with you. This has to be provided and supportive. So they're not left alone to prove themselves and just stay in that cycle.
I have a comment. I think the quality of life, I think the pace is not going to change. We just have to live with it till 2030 or 35.
You don't think it's going to be slower?
No,
Okay.
it's going to be slower till 2030. And there's a stretch now because there will be a Vision 2040. So I don't think the pace is going to go away. I think just to touch upon the quality of life, I think the quality of life equals the availability of services that will provide the support. I think what we're lacking right now is the services. I used to live in the UAE. Everything is very accessible and available and top-notch. It's the same model that Singapore have.
Yeah.
We are lacking behind when it comes to services. We're not designed in this way. So I think once we get there, hopefully soon, the quality of life will increase,
Inshallah.
in correlation.
Inshallah, it's a work in progress. I mean, just 7 years ago, we announced Vision 2030. Look where we are today. We're surpassing our KPIs. We have women in leadership positions. So it's only a matter of time, inshallah, until we get hopefully to that. I want to take questions from the audience, and we also have a couple of virtual questions. We're going to take two now from the virtual. Look at the world. We can take questions virtually from our phone, and then I'm going to open the mic to our audience. I'd like to ask this question to whoever would like to answer it. So would love to hear all of your answers. As leaders in your respective fields, what advice would you offer to women seeking to enter the healthcare industry in Saudi Arabia?
She has to be passionate, and she has, you have to have a purpose, why you want to enter this. It's not like what is the vacant, what is the availability, what I really want to do. I want to wake up every day and I have a purpose in this life. What is it? If it's related to healthcare, she will find her way, but she has to be really passionate. And some people, they don't know, they just want to explore. She's young, she can do this, just to try. And I think if you believe in anything, you will excel, because the opportunities everywhere. It's not only in healthcare. I always go to the NGOs and I enjoy what they are doing. I go to the private and I love what they are doing. It's, again, if you are passionate about it, you would.
I think believe in yourself. I think don't compare yourself, to the men or the women. I think just, keep yourself focused on what you want to achieve, which is your purpose. I think this is one, and then to work very hard. Firstly, on yourself.
Yeah.
Because it's a constant thing, obviously. But the hardest work should be on yourself. And then the work that you produce and you put your heart and soul into every day.
I also agree. However, I would just emphasize on really developing yourself. It's a tough field. It's a very demanding field. When you're in, it's very exhausting. But when you put yourself on at night, it's very rewarding personally. However, it's even though it's very dynamic, but it has its stability because it's a very complex system. So it still has a very traditional part of it that cannot be shaken easily. It's one of the oldest established systems in the world. So work on your competence. It's a continuous update. You cannot just have a degree and sit on it. You have to continuously, a lot of things become obsolete as we go along. Stay focused. It's not a competition, and it's just you have to do it with love. You need to have love to cope with it.
Amazing. That's wonderful advice. I'd like to open the floor to the audience if you'd like to ask a question. Yes. Yes.
Absolutely. I was having a conversation earlier today. And I heard, don't quote me on the numbers here.
Okay.
I heard, we need to check. That based on polls on public opinion here in Saudi, when they wanted to kind of have women participate in the job market and women to drive. In terms of job participation, 90%, they're ready for it. But in terms of women in managerial position, it dropped to 80 something, 82, I think, something like that. And then we were discussing about, okay, so now we exceeded these, objectives in terms of we wanted to have 30% of women participation. Now we're bragging about, it's not 2030 yet, and we've done that. But we're seeing a bit of changes in the market that we didn't really predict when it comes to how are we perceived today by our male colleagues as well. How is that really kind of being accepted? So the polls at the beginning before the participation were pro, but now there is a bit more competition. And we think just by time, we assume that time means progress. But it's not usually the case because there's so many different variables that maybe we haven't considered, and maybe we are aware of, but we're still not considering in the process of moving forward. So we're discussing a lot about Vision 2040, how is these targets are going to look like. But also, as we set these targets, are we going to look at men as well? Because we're talking about the ecosystem quite a lot. But what kind of investment do we need to invest in terms in men as well for them to play a role beyond the services that we need to provide for us to continue to ensure that progress not only in the healthcare industry but also beyond? Am I allowed to ask another question?
I love your question. I love your question. I can answer. I think for men, it's the cultural belief and stigma around, the segregation, men and women, you're a woman, I'm a man, It's still there, we can't deny it, despite, the number of women in the workforce and in leadership, I think removing the stigma of, you can take a paternal leave for 3 months and not work, and your wife goes to work every day. It's okay that your women drive, your wife drives and you don't drive. I think this is, like in this first wave of the strategy is more about increasing a lot of things and then getting to a level of equity or equality. I think the wave two, these are all my opinions. I think it's gonna be more about delayering the cultural beliefs because we're in a pivotal moment in time. We're in a renaissance, and the proof point is all of this, because this didn't exist from before, and it wasn't really possible for us. Not in a bad way. This is in a very good way. So I personally believe it's going to be more about real equality in the next phase.
Yeah, if I may add, it's basically, I agree with you. What the push we are getting is just because we are lagging behind. So that's the push we got. But hopefully later on, we pick the qualified person, regardless male or female. And that's how we prevail. Yeah, that's common sense. If you have the same pool, you will pick the best. It's not going to be a topic, male or female. Or you ask females to join because you want to have a number or quota. This is humiliating. It's not. I'm not joining a meeting because I'm female, just to fill a number. I'm coming with my brain. And if I'm not adding a value, I will leave the room. And this is how we get stronger. It's like you are adding a value. You are a quality. You are not a number.
Very true.
I agree. I have nothing.
I can add one more thing. Actually, it's not competitive right now. It's not competitive because if you have a good profile and you're a female and you're Saudi, you already ticked all the boxes. And therefore, it's a plug and play. And I don't mean it in any, demeaning or negative way, just echoing what Doctora said, but it's also equivalent to men as well. So you're getting this inflation in jobs and titles, but then you look at the competency and capability level, and I think it's a bit
shaky.
It's not shallow. It's a bubble.
Sure. Yeah.
So I think we're getting there. we're getting there. I think, these holes will be exposed with time. I hope not collapse the system, but they will be exposed and it will be more competitive and more equal. So yeah, I hope we answered you.
I actually want to read a comment that I just got from a very special person in the audience. Firstly, thank you very much for the shout outs. I have never felt prouder to be building with you and for women and their health in the GCC. We are in the process of establishing a new Women's Health Research and Development Institute in CAX, Riyadh, and launching our hybrid model in the kingdom. In each of your opinions, if you can solve one challenge in women's health today, what would it be? Sophie Smith, Nepta Health. So she has a question also, not just a comment. What would you do if you can solve one challenge in women's health today? What would it be?
أنا عندي جواب بس أخذت جواب.
لا go ahead.
Actually,
And I would really emphasize on having a supportive environment at work to reduce the frictions of women navigating systems, especially when they want to establish families. So deciding to have a family should not be an obstacle, and it should not be a personal struggle. So, I used to hide in the bathroom to put my milk and do these things, and I have all these horrible stories. It was fine. This is my personal story. However, we should have that system to support. So creating that environment to accommodate our special bodies and.
Absolutely, yes.
I would say mental health.
Mental health.
Yes.
How important is mental health?
It's very important, and women are struggling. Either when you are talking about the workplace, it's the burnout. It's work-life balance. It's just too much. And she cannot even vent. She cannot say anything because if she said, okay, you are women, you don't fit, leave the room. Okay. So she work extra and put extra efforts. And again, mental health, talking about female having a babies, postpartum depression, stress, managing the whole family and going to work, driving. Mental health is really a problem. They need the full support. They need to know it's okay. It's okay not feeling good. It's okay to have anxiety. It's okay. This is normal. They don't talk. I teach in the university and they break out. They just have a panic attack. And they feel ashamed. They don't want to talk. They don't want to share. And which is okay. I think we have to learn. We have to teach them how to cope with it. We have to have a health and wellness departments in each organization. In any building like this, you have to have health and wellness. You have to have a coach. You have to have a mentors around. This is how we go stronger and to have your resilience. Mental health, we don't talk. We come in the room, everyone's head now has so many problems. And we don't share. We just pretend we are strong and we can do it and we can handle it.
Yeah.
No, that's okay. This is something you need to acquire. This is something you need to learn, and you need coach. We don't have this culture of having a coach, mental coach, life coach, someone wise in your family, with your teachers, someone you admire his opinion, you come and talk to. I think this is the culture that we need to bring up and to talk to, either in the workplace or with our kids, with our families, with our students.
Inshallah, step by step.
Yeah. But since she asked, let her start.
Number one thing that I always hear from amazing female leaders when we ask how can we bring in more females into the mentorship.
Is very
That's one of the most important
Absolutely.
aspects. We have 5 more minutes left. I want to give the floor to our audience. We have 2 questions. So yes.
Hi, my name is Sunar from Arab News. Hi, Ms. Noor. So I have a question actually regarding mental health. And, they always say even a therapist needs a therapist.
True. True.
We talk so much about how mental health is so important and it makes us prosper. It's really the foundation of who we all are. And if our foundation isn't strong, then we won't be able to kind of be good in our daily lives. So in what ways can ministries or governments aid to the people that are seeking mental health? How can we make mental health awareness more of a thing in Saudi Arabia?
Yeah, I can take it.
Yes.
Yeah, I love your question. Thank you so much for asking this question. Incentives. So what we're doing is we're designing financial and non-financial incentives to attract investments to help bridge the gap in the value chain, which is around creating mental health facilities, clinics, campuses, rehabilitation, you know, in not within the city, you know, within, you know, like, you know, proximity or periphery of the city, sorry. That's the key role, and you'll see things happening very soon. But then also there's another role beyond investment, which is public awareness. And you know, again, it's the stigma of I'm not feeling good, there's something wrong with me, and it's okay to you know to share and go forward. But then we have also an issue. The stigma is an issue. We don't have enough facilities, but also we don't have specialized workforce. We don't have enough psychiatrists, but also we don't have psychologists. We don't have cognitive behavior therapy, for example. And then within that comes, you know, a very big, I would say, taboo that no one talks about, which is substance abuse.
Yeah.
All sorts of substance abuse. The role of governments and ministries is to unlock the sector with incentives and to raise awareness and to, you know, for substance abuse, to decriminalize people that come forward. You're not a criminal. It's not going to be a black dot in your profile. You will be hired. You will be integrated back into the system. So these are the active roles that Ministry of Health, Ministry of Investment, and other entities are working very hard on tackling.
It's very challenging. Since we have the insurance representative here, there's another thing that's happening in the community. When they get treated, they don't use the insurance because the insurance, they will report back to their workplace.
Yeah.
And that's a taboo. Well, she's not well. She's mentally has a problem. Yeah, we expect whatever she's doing. So they shame her for this report. So people, they go and they pay themselves. They don't use the insurance just to avoid this. And this is a breach in confidentiality. They should not report this. But I think it's happening right now. And this is one of the problems.
Well, that was such an amazing conversation. We've learned so much throughout this 1 hour, and I can't believe it's been 1 hour. It felt like 5 minutes. There's so much more to discuss, and hopefully we can do this again. And thank you all for being so attentive and interested in this conversation. And I know I was very interested in this conversation. We'd like to get to closing remarks now. And thank you all so much.
Thanks.
Thank you all.
Thank you. Thank you, everybody. Today, we have explored the complex interplay between women's economic participation and the significant impact that they have on the healthcare in Saudi Arabia. Amazing conversation. We had a lot of text from our fellows, from our mentors, from everyone, feeling happy that we're talking and we're covering such subject. We have the privilege to have from hearing from exceptional panelists. Thank you so much. You offered your unique perspective on how we can take effective steps towards achieving this more gender inclusive healthcare system. A special thank you to all of your speakers for an amazing, for your valuable time and expertise. Noor, thank you so much for this skillful moderation of this session. I owe a big thank you for the US Embassy as a funder, and Pepsi, of course, as our main funders. Karina Klein, she's in the room. Thank you so much for being there. I also want to thank American Express and AmSham for all the support and for helping us make this event true. Thank you, Jamila Dajani, Dana Ajlani, I'm very bad with name, and Pia for your support, for your invaluable support as well. Thank you everyone for attending and for your valuable time. And we hope to see you in other events as well. Thank you, everyone.